Welcome all to our new series on cardiac patients, advice and support. My name is Mr. Abdelhadi Ismail. I'm a cardiac surgery trainee. I will be interviewing Professor Sonal Ori, who has been an adult cardiac surgery consultant for over 20 years now and is well known for his contributions in cardiac surgery education and training. And he is the lead of one of the very successful units in the UK. And he will be telling us more about the preoperative and postoperative care of cardiac patients. Thank you, Prof, for having us today. Can you tell us more, Prof, about this series, please?
Yes, of course, and thank you for arranging this. When I thought about this series, I was hoping to address some of the common questions patients ask us almost on a daily basis. A lot of patients feel stressed prior to and indeed after heart surgery, and this is in large part because they probably don't have enough information and understanding of what is involved, and this probably extends to their family members as well. I've been in a position of a cardiac patient family member as well, so I can fully understand the anxieties and the stresses which both patients and their families have to endure during this very difficult period. I'm sure we can explain clearly the process before and after surgery in simple terms, focusing upon patients' concerns, which will hopefully reduce the mental stress and anxiety, which is often a problem. My intention in this series is to cover both preoperative and postoperative periods in a fairly simple way, and hopefully this will then be accessible to every patient and their family member on the internet, obviously for free. So every unit has its own protocols and pathways, and I'm going to make this as generic as possible so it's applicable no matter where the patient may be having their heart operation, and hopefully that will avoid confusion.
That's brilliant. Shall we start then, Prof?
Yes, sure.
Shall we start with the postoperative care then?
Okay, let's discuss postoperative care.
My first question is, how long does it normally take for a heart surgery patient to recover? I mean, the rehabilitation process in brief, of course.
Okay, I think the time lines for patients vary a lot depending on how well they are and how old they are. But we say that the average period of time is about 12 weeks before they make a full recovery. And obviously, if they are more older, this may well be longer. And if they are sicker before they come into hospital, again, they will take a longer period to recover.
That's brilliant. And in terms of the phases of rehabilitation, what phases do the patient normally go through in the rehabilitation process?
We say that generally there are 4 phases of rehabilitation, and this involves a whole team of individuals who will be there to care for the patient. Obviously the surgical team, the nurses, the physiotherapists, the dietitians, the first phase really begins while the patient is starting to make that recovery straight after the operation. And during this early phase, the patient will be instructed by the physiotherapist and the nursing staff in how best to start to walk again, how to make simple sort of maneuvers in terms of how to get out of bed safely without putting stress on their sternum, which is the breastbone, and also after that how to start to climb stairs. And this, as I say, would be a very structured, progressive program.
That's brilliant. And the second phase of the recovery?
Well, the second phase really is a phase which starts after discharge from hospital, and this is a period which lasts for about 2 to 6 weeks. And the aim of this phase is really to try and get the patients back to active life. And the aims of this phase are to improve the exercise or the functional ability of patients, and to improve their endurance, and also to provide education on the sort of lifestyle changes which are important so that they can continue to improve their health into the distant future. And many patients often have a lot of fear and anxiety, and I think about how much they can do and what they should do, and I think it's important that this educational process reduces that fear and anxiety. And some patients obviously find it difficult to optimize and make readjustments to their social, if you like, interaction and their psychological well-being. So I think education is really the main focus during this phase,
Yes,
and understanding
of course.
what needs to be delivered and how it should be delivered.
Yes, of course. And phase 3 and 4 of the recovery process?
Well, phase 3, if you like, is a much more dynamic thing, and often involves joining a rehabilitation program where patients will have a period of usually about an hour where they can have a very structured exercise program which has been planned depending on their needs.
Yes.
And their ability to exercise. And this period lasts somewhere between 6 and 14 weeks. And as I say, this is a very directed program under instruction of a physiotherapist, usually in the community.
Yes.
And a lot of hospitals and indeed regions have their own rehabilitation programs.
Yes.
And during these rehab programs, often there are measurements which are taken of the patient's blood pressure and heart rhythm and rate, so that they can understand how they are progressing and if they are responding in a normal and safe way to exercise.
Yes.
And then I think the main, if you like, ambition for this phase is to try and get the patients back to an independent lifestyle. And obviously, if they're young enough and they were working before, to try and get them back into work. And the other emphasis is to try and educate patients so they understand the concept of disease prevention in the future, what we call secondary prevention.
Yes.
And so they would have a lot of input in terms of modifications they may need to make in their exercise,
Yes.
modifications they may need to make in their lifestyle in terms of controlling, obviously, dietary input.
And what about phase 4, Prof?
Okay, so the main aim of phase 4 for patients is for them to understand the long-term strategy of rehabilitation, and that's really a sort of preventative strategy. It's a sort of prophylaxis or prevention for the future to prevent patients developing disease and relapsing. And so there is a lot of education as regards what they can do to modify their lifestyle in terms of exercise, in terms of diet, and in terms of managing pre-existing conditions like diabetes and blood pressure. For example, reducing their salt intake, making sure that they are very actively and very closely controlled in terms of the diabetic management, for example, and also getting very good dietary advice in terms of what they can do to modify their diet if it indeed requires modification.
All right, Prof, that brings us to our second question. What about the daily activities such as walking, climbing stairs, etc.? What would you tell patients about those activities after cardiac surgery?
Okay, well, I think for the sake of clarity, it's probably useful to divide these into activities that the patients would be doing straight after the surgery, and then the activities they would be expected to be doing after they've left hospital and have been discharged. So while they're still in hospital, once their lines have been taken out, they would be starting to take the first few steps of walking around the corridors of the hospital and within the ward of the hospital, and then obviously they would also be encouraged to take their own shower once any sort of pacing wires which may be attached to the chest have been removed. And I think it's important that as regards the wounds are concerned, that patients remember that they can take a shower, that they should wash with just warm water and obviously clean soap, and it's very important to make sure the wounds are dried with a clean towel after any shower has been taken. So as far as walking is concerned, they will be given a very individualized plan in terms of how they should be walking. Obviously, if they've been walking with some sort of aid, with a stick, before they come into hospital, then that's something they may continue to have to use while they're beginning to mobilize in hospital. And each patient obviously progresses at a different rate, and there is no one size that fits all. As far as stairs are concerned, the physiotherapists will be working with the patients again, particularly for patients that do have stairs to climb when they go home. Many patients, of course, don't need to climb stairs in their own dwellings, but I think it's a very good thing to be doing while you are in hospital. And it's important to remember that when one is climbing stairs, that one shouldn't be using the arms to pull oneself up the stairs, because that will put increased stresses on the breastbone, and to use basically the power of the legs to climb the stairs. But the physiotherapist will be very closely observing how you are climbing the stairs and will give you good advice to do it properly. Okay, so after going home, you can then move on to more demanding activities. But we do advise that as far as driving is concerned, that one can be a passenger in a car very safely with a seatbelt, but really patients shouldn't be driving for at least 6 weeks after surgery, again because we don't want any stresses on the bone. We want the bone to heal up before you can then drive a car independently. When traveling, as a passenger, I would encourage patients to not be in one position for more than 2 hours in the car, and to really get out and stretch the legs. After 2 hours, take a break, and then you can then return to the vehicle and continue on your journey. And I think the other thing we emphasize quite a lot is about what can and what you cannot do in terms of lifting. Because the sternum is still healing, your breastbone is still healing, it's important to avoid lifting and pushing or pulling anything heavier than about 10 pounds. And this should be avoided for at least 6 weeks after the operation. And this obviously includes carrying children or groceries or suitcases, or doing any form of gardening such as mowing the grass and moving furniture. I'm afraid that's going to have to be done by friends and family.
I should tell that to my wife.
And the other thing is, when you are actually undertaking activity, try not to hold your breath. This is really counterproductive. So as far as work is concerned, most patients begin to feel ready to start working maybe 6 to 12 weeks, depending on the sort of job that they normally have. So obviously, if it's a physically demanding job, they will not be ready for at least 12 weeks. If it's a desk job, then they may want to come back to work, particularly now we have distance sort of working from computers these days. They may want to go back to the desk and do some work after 6 weeks, and I think I would encourage that, and I think it helps to reduce one's anxiety and stress by doing some work. The other question which often comes up and is one about sexual relationships after surgery. And I think most patients, if they were sexually active before, are ready to resume activity 2 to 4 weeks after discharge, and that can generally be done very safely. But obviously, if there are concerns, then it's good to get medical advice from the surgical team or from the nursing team.
All right, thank you, Prof, for that. And hopefully we'll meet again in the rest of our series. We'll discuss further more and more concerns about the patients. And please feel free to send us any questions, any inquiries you have, any concerns you've got, and we're more than happy to answer those. Thank you, Prof.
Okay, thank you, Hadi.